I got some great myths versus facts. You know, Dr. Flores, I might actually participate in this one. I think when we did the sleep study, the sleep show back in the fall, I gave you all the questions, more or less. I might have did one at the time, but, you know, I'm going to give you the hard ones and I'll give myself the easy ones, something like that. So we'll see what happens. That's all good. So here we go. Myths versus facts.
Fair, but all right.
I know. It's crazy how that works that way, but I guess we got to do what we got to do. Here we go. I'm going to first statement. So what I'm going to do is I'm going to say a statement, everybody out there, and then Dr. Flores, if I participate, we'll say myth or fact. We'll kind of go boom, 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 kind of rapid fire these kind of things, but we'll hopefully have some good answers and help clear the air on some of the misconceptions about obstructive sleep apnea. Here we go. Dr. Flores, first statement, myth or fact. Obstructive sleep apnea is caused primarily by obesity.
Fact.
Please explain.
85% of people who have sleep apnea as a result of carrying extra weight. If they lose the weight, generally it improves. 15% have it as a result of airway anatomy.
Wonderful. Thank you. Here we go. Next statement here. Here it is. Surgery. This one's for you. Surgery is the surest way to fix my obstructive sleep apnea. Myth or fact?
Myth.
Please explain.
50% of people who have ear, nose, and throat surgical intervention for sleep apnea will continue to have sleep apnea once they recover from the surgery. And then amongst those that actually see improvement, so the 50% that actually benefited from the surgery, half of them will have a recurrence of sleep apnea within 5 years, either because they gain more weight or the tissues in the back of the throat begin to remodel themselves. So when you look at 5-year outcomes, there's only about a 25% success rate, which is not great.
Wow. There we go. I like this one. Here we go. I'll take this one. I like this one. Wearing a CPAP mask makes me look unattractive. I will say that is a myth. And I'll tell you why. There was actually a small study that was done where they had people, they took photos of people pre and post CPAP treatment. It was a small study. I think it was about 21 people, and it was done, I believe, in 2013. And what they did was they took photos of the people before they got in before they started their CPAP treatment, and then they took them after. And what they did was they showed the photos to actually physicians. And so what they saw in people that were properly treated with obstructive sleep apnea, they didn't have bags in their eyes. They looked rested. They actually had more youthful look. Their cheekbones were risen a little bit, and they just looked better compared to their pre-treatment pictures. So that is a myth. So CPAP machine is the real deal.
Yeah, I'll add a little bit to
Please
that.
Go ahead.
Particularly for some of our younger patients, they are really concerned about what their bed partner is going to think of them as they wear the PAP device. And I typically remind people, if you're going to have a romantic night, clearly you're not wearing the CPAP. But when you're sleeping, snoring is not very attractive either. And so clearly you can easily navigate around CPAP therapy and the fear of how it's going to impact your love life, probably.
I like to say CPAP machines keeping couples together for years and years and years. There you go. Here we go. Next statement, myth or fact? All right, here we go. Dr. Flores, children rarely experience obstructive sleep apnea. Is that a myth or fact?
That is a myth.
Please explain.
In fact, one of the very common misdiagnoses that are out there are pediatric patients, so kids who are diagnosed with ADHD. I'm not saying ADHD is not a real diagnosis by any means. I'm just saying that the symptoms of obstructive sleep apnea in kids oftentimes are different than in adults. In kids, when they're sleep deprived, they may misbehave, they're inattentive, they may act out. And so symptoms are very similar to ADHD, when in fact a kid may not have ADHD, they have obstructive sleep apnea. And then the other thing is that in kids, they can have sleep apnea even if they're not obese. If they have enormous tonsils in the back, if they have tonsillar hypertrophy, they could be a thin child, but yet have bad sleep apnea. And so tonsillectomy is the treatment for kids most of the time, and obstructive sleep apnea is common in children. We see it.
Wonderful. Thank you, Dr. Flores. All right. I like this one. We'll do a couple more of these. So this one's for Dr. Flores. It's kind of a two-parter, but here we go. Everyone who snores has sleep apnea, and everyone who has sleep apnea snores. Is that kind of a myth or a fact?
Myth.
Please explain.
So it's been estimated that greater than 50% of all adults snore. And so you can have what we call benign or heroic snoring. Benign to the person who's snoring, maybe not to the bed partner, but you can rattle windows and you're not obstructing, you know. Whereas you can also have some people who have such bad sleep apnea that they don't create the sound of snoring because all they do is obstruct, gasp, obstruct again, and they don't have the opportunity to rattle the tissues to generate the snore. So you can have bad sleep apnea without snoring, and you can have bad snoring without sleep apnea. Myth.
Wonderful. We'll do a couple more of these. Here we go. I'll take one. Obstructive sleep apnea is no big deal. And I would say that's a myth. It actually is quite a big deal. As we talked earlier, there's a lot of medical conditions that are associated with obstructive sleep apnea, and certainly compounded when the obstructive sleep apnea is not treated. And those are anything from diabetes, obesity, mood disturbances, heart disease, heart failure, stroke. You just name it. There's a very good link. And this is why it comes back to the point of that we need to make sure that people get this disease diagnosed early. As Dr. Flores said earlier, 5 to 7 years average time to make this diagnosis. That's a long time. But if we make that diagnosis earlier, we can intervene earlier and people can live better and healthier lives much more rapidly. Here we go. I'll take this last one. This one's for you, Dr. Flores. I won't take it. I'm going to give it to you. So here we go. Getting tested for obstructive sleep apnea is both scary and a hassle. Myth or fact?
Well, that's a myth. I mean, we kind of went over it. I think the sleep labs are comfortable and it's a one-night thing where you can get the diagnosis. But even if you're very resistant to it or just simply can't go, home sleep studies are extremely easy to do. And so really the biggest roadblock is just the idea of you going through it. Once people go through it, they'll come in and say, oh, it wasn't that big of a deal.
Wonderful. So there you go. Myths versus facts. Thanks, Dr. Flores. So we have about 5 minutes left.